The capture of the Axis forces in Tunisia in May 1943 marked a turning point in World War II, bringing approximately 275,000 German and Italian soldiers into Allied hands as prisoners of war. Among these captives were numerous German medical officers, doctors, surgeons, dentists, and other healthcare professionals who were about to embark on an experience that was unprecedented in military history. Far from being treated merely as defeated enemies, these men would find themselves regarded as medical colleagues by their American captors. This is their documented story, drawn from historical records, military archives, Red Cross reports, postwar memoirs, oral histories, camp newspapers, and verified accounts. It's a tale of professional respect amid conflict, ethical adherence to international law, and the surprising ways in which medicine bridged the divide between foes. To understand this unique chapter, we must start with the framework that made it possible. The 1929 Geneva Convention. This international agreement established special provisions for captured medical personnel during wartime. It mandated that they be treated with respect for their professional status, not compelled to perform non-medical labor, and allowed to retain certain privileges to continue their healing work. The convention also required equal treatment for all prisoners, including payment of wages equivalent to those of the capturing nation's military, and prohibited forcing officers into manual labor. The United States, as a signatory, took these rules seriously and implemented them more comprehensively than many other nations. For the German medical officers, this American commitment to the Geneva Convention would prove eye-opening, often surpassing the standards they had known in their own military system under the Nazi regime. The journey for these prisoners began immediately after capture. German POWs, including the medical staff, were typically shipped across the Atlantic on Liberty ship stores massive cargo, vessels that had delivered supplies to Europe and were now returning empty to the United States. These ships could carry as many as 30,000 prisoners per month, docking at ports like New York or Norfolk, Virginia, where the men were processed and distributed to camps across the country. From the outset, the treatment set a tone of unexpected humanity. Unlike the brutal cattle cars used for prisoner transport in Europe, which were often overcrowded and devoid of basic amenities, the Germans traveled in actual passenger accommodations. They received regular, substantial meals, far more generous than the rations they had endured in the field. This wasn't just a logistical choice, it had a profound psychological impact. For medical officers accustomed to scarcity and hardship, it was the first glimpse of America's vast resources and its pragmatic yet humane approach to handling captives. By late 1943, these German POWs had been dispersed to numerous camps throughout the United States. Texas, with its warm climate deemed similar to North Africa, aligning with Geneva Convention requirements for suitable living conditions, hosted a particularly large number of these facilities. In 1943 alone, 3 more camps were authorized in the state. Fort Sam Houston in San Antonio, which started as little more than a tent city with large 176-man tents, shared by prisoners and their American guards. Camp House, near Gainesville, and Camp Hood, later known as Fort Hood, in North Carolina. These camps varied in size and sophistication, but their medical facilities generally far exceeded what the German officers had anticipated. Each camp maintained infirmaries, and some boasted substantial hospital setups where captured German medical personnel could continue practicing their profession. What truly distinguished the experience of these German medical officers was the professional recognition they received from American medical authorities. In a war marked by atrocities and deep-seated animosities, this collegiality was remarkable. There were documented instances of German doctors treating wounded American soldiers, just as captured American physicians cared for German casualties. As a general rule, these enemy medics were treated not as prisoners first, but as respected colleagues. One American doctor later recounted how he and his German counterparts freely exchanged knowledge, teaching and learning different medical procedures from each other. The U.S. Army Medical Corps provided the same level of care to wounded German prisoners as it did to Allied troops, adhering strictly to the principle of medical impartiality. This courtesy extended beyond symbolism. German doctors were addressed by their proper medical titles, doctor or professor, consulted on complex cases, and included in professional discussions. Such treatment stood in stark contrast to the expectations shaped by Nazi propaganda, which portrayed Americans as barbaric and materialistic. Instead, these officers encountered a system grounded in ethics and abundance. The medical facilities in American POW camps represented a significant investment in prisoner welfare. Take Camp Butner in North Carolina, for example. Its convalescent hospital treated nearly 14,000 patients during the war. Beyond basic rehabilitation, it offered social readjustment programs, guidance counseling, technical training, vocational advice, and general education. By late November 1945, the hospital had a staff of 2,200, assisted by 414 German POs. Patients, whether American or German, received round-the-clock attention in an integrated environment where enemy medical staff worked side by side with their captors. The quality of equipment and supplies in these facilities often surpassed what German military hospitals had access to even before the war's devastation ravaged their infrastructure. German POW, including medical personnel, also benefited from educational programs that were extraordinary even for free citizens. Nearly every camp featured a library stocked with donated books and magazines and collections rivaling those of an average high school. Camp Fannin in Texas, for instance, boasted a library with over 2,500 volumes and an impressive 80% circulation rate among prisoners. For medical officers, this meant access to current medical literature, journals, and research papers resources that had been severely restricted in Germany due to wartime shortages and Nazi censorship of non-Aryan scientific work. Some camps forged even more remarkable ties with American universities. A report from Camp Butner in April 1945 noted 110 prisoners employed as mess attendants at nearby Duke University and the University of North Carolina. While these roles were non-medical, the university connections opened doors for German medical personnel in the camp to engage with American academic medicine. Lectures, consultations, and informal exchanges became possible, representing a level of integration between enemy prisoners and U.S. institutions that would have been unimaginable under the Nazi regime. As the war progressed and the U.S. sent millions of its own soldiers overseas, labor shortages at home led to German POWs being employed in various industries, canneries, mills, farms, and other low-security sites to support the Allied war effort indirectly. For medical personnel, this often translated to assignments in hospitals and clinics, where their skills were most valuable. Those who volunteered for medical duties were compensated according to their rank, as stipulated by the Geneva Convention. Though the pay was modest, it symbolized recognition of their professional status, profoundly affecting men who had braced for humiliation as conquered foes. Nurses played a pivotal role in this dynamic. Initially, some American nurses grappled with personal feelings, wondering if they could set aside resentment to provide top-tier care to former enemies. Official policy in theater hospitals prioritized Allied casualties over enemy ones. Yet, most nurses quickly adapted, viewing the Germans simply as patients in need. They treated them no differently from American soldiers, embodying a professional ethic that separated duty from nationality. This integration, despite reservations, offered German medical officers a model of medical ethics that rose above political ideology. The abundance of medical supplies in American camps further astonished the Germans, who had grown accustomed to wartime scarcity. Bandages, medications, surgical instruments, these were available in quantities unimaginable in their depleted homeland. Pharmaceuticals, in particular, left a lasting impression. Sulfur drugs, rationed stingily in German military medicine, were used liberally here. By 1944, the introduction of penicillin in some facilities showcased a therapeutic edge that German medicine entirely lacked. Overall, the medical treatment for German POWs met or exceeded standards for U.S. personnel. The same surgeries, drugs, and rehab services, faithfully applying the Geneva Convention's equality mandator principle, often flouted elsewhere but upheld rigorously in America. Texas's concentration of POW camps amplified these experiences. Camp Butner, sprawling across 40,000 acres in Granville, Person, and Durham counties, served as both a combat infantry training site for 30,000 U.S. soldiers and a holding facility for German and Italian prisoners, who worked as cooks and in other duties. Its scale and medical components exposed German officers to American military medicine at its peak, a stark contrast to the desperation unfolding in Germany as the war neared its end. Professional relationships blossomed within these constraints. American doctors gleaned trauma techniques from Germans with battlefield expertise, while Germans learned about antibiotics, anesthesia, and surgery advancements. These exchanges, recorded in postwar accounts, marked unprecedented collaboration between enemies. The role of American nurses challenged German assumptions to their greater authority and autonomy in decision-making, and procedures differed from the physician-dominated hierarchy back home. Fort Sam Houston in San Antonio, known as the home of Army medicine and the birthplace of combatments, housed up to 1,000 German POWs starting September 15, 1942, while permanent camps were built. Its medical training focus allowed German personnel to observe U.S. education methods, influencing their views on clinical training. Dental care, often overlooked, fostered more interactions. German dentists worked in camp clinics, providing routine care beyond emergencies, exceeding Geneva requirements, and demonstrating comprehensive welfare commitment. Public health efforts involved German officers in disease prevention, sanitation, and education, showcasing America's prevention over treatment philosophy effective in crowded camps and a lesson for post-war Germany. Mental health treatment stood out. Combat fatigue early, PTSD recognition was treated humanely with therapy and meds, unlike Germany's punitive stance. German psychiatrists observed this, gaining insights into compassionate care. As the war ended, repatriation loomed. Many Germans had spent years in custody, practicing under superior conditions. Final medical exams were joint efforts, reinforcing collegiality. Post-war, about 5,000 Germans immigrated to the US, with others visiting. Friendships endured, including professional ones. Returning officers brought American practices home, influencing ethics, patient rights, and training in rebuilt German medicine. Though hard to quantify without personal records, their advocacy for practical, integrated education echoed US models. Some became educators, subtly shaping the field. Pharmacists gained from US production and quality standards, aiding Germany's industry rebuild. Surgical exchanges enriched both sides. Germans shared trauma skills. Americans, aseptic and post-op care. Lab specialists learned standardized procedures. Radiologists, better equipment and safety. Red Cross inspections ensured compliance, facilitating global ties. Camp newspapers, with medical articles, preserved perspectives. Limited research on non-sensitive topics kept skills sharp. Epidemic responses taught containment. Supply management models aided reconstruction. Wound care advances improved trauma outcomes. Preventive programs, rehab emphasis, and communication styles shifted toward patient-centered care. Ultimately, this experience showed medicine's transcendence over enmity. Despite barriers, it fostered bonds, influencing post-war medicine and affirming shared healing obligations. German officers returned not just with knowledge, but proof that respect endures war, a timeless lesson for medical ethics today.